today we are taking 6 decisive actions, guided by gold standard science and the week 1 executive order from President Trump to protect children from chemical and surgical mutilation. This morning I signed a declaration: sex-rejecting procedures are neither safe nor effective treatment for children with gender dysphoria. Additionally, CMS is proposing 2 new rules. The first rule will bar hospitals that participate in Medicare and Medicaid, which is almost every hospital, from performing these dangerous and harmful procedures. The second rule prohibits the federal Medicaid dollars from funding the sex-rejecting procedures on minors. The FDA is issuing warning letters to 12 manufacturers of breast binders, which are medical devices used for purposes such as assistance in recovery from cancer-related mastectomies. The FDA is telling these companies that the illegal marketing of breast binders to children for the purpose of treating gender dysphoria commits significant regulatory violations and requires swift congressional or corrective action. Furthermore, HHS is also moving to reverse the Biden administration's attempt to include gender dysphoria within the definition of disability. Finally, our Assistant Secretary of Health, Admiral Brian Christine, today signed a public health message to inform healthcare providers, families, and policymakers that current evidence does not support claims that puberty blockers, cross-sex hormones, and surgeries are safe and effective treatments for pediatric gender dysphoria.
We are in a weird place in America where we have mixed politics and medicine. And you know what you get when you mix politics and medicine? Politics. There is no medicine left. We are taking major steps at CMS to stop a funding process that has led to irreversible medical interventions with 2 major actions. The first, we're announcing a notice of proposed rulemaking that ends taxpayer funding of sex-rejecting procedures for children in Medicaid and CHIP, full stop. Second, to reinforce the need to protect our children, we are announcing that certified Medicare and Medicaid hospitals, pretty much everyone in the hospital in the country, will no longer be permitted to perform certain sex-rejecting procedures on children. Any hospital that does offer sex-rejecting procedures to vulnerable populations of pediatric-age kids will no longer be able to participate in the Medicare and Medicaid program.